what should be a potential treatment for hair loss? And people talked about finasteride, people talked a little bit about minoxidil, people talked a little bit about proteins. And it's kind of difficult to answer because it feels like it's a constantly evolving thing. You see these stem cell treatments being put out. So I'm going to position the answer from my perspective as a pharmacist and as an FDA regulatory lawyer who works in this space. Overall, here's what it comes down to. Both minoxidil and finasteride are both drugs. They've been approved by the FDA for treating hair loss, which is great. However, the fact is that minoxidil, for example, can cause a drop in blood pressure. It's actually a blood pressure treatment. So be careful of that. And there's other side effects that go along with it. Finasteride, on the other hand, is actually used originally for what's called benign prostatic hypertrophy, really like prostate enlargement issues. If someone has an interest in that, I'm happy to look into the specific use of finasteride in women for hair loss. What I want to talk about were the two other topics that do get pulled in. First one is taking it into your stomach, eating it, if you will. The thing is, proteins get denatured, which means that they don't work the same way they were intended when you swallow the protein. So taking tablets is not going to really help you. Proteins that are swallowed are not absorbed in the same way. So probably not the greatest treatment in the world. The other position is, what if you just slap it onto the skin? Proteins are huge molecules. They will not be absorbed into the skin. I don't know what anyone's telling you. They cannot be absorbed into the skin. So there are no proteins that have been approved by anyone, by the FDA or any regulatory authority I'm aware of, for hair loss, either orally as a application on the skin. So I'm not sure either one of those makes sense. The other idea would be, well, what if I take stem cells and inject that? Well, the evidence around that is negligible at best. That's not to say that couldn't work, but we don't have enough data yet. And if someone did have the data, I can assure you, they would go after FDA approval because you can make billions of dollars doing that, but no one's doing it. And that tells me something. If you have any questions, let me know. Do you think that I'm wrong? What am I missing? Maybe I'm missing something. Love to hear your thoughts. This is the Darshan